Correct. So I want to start with a more general question, but please answer them specific to your field of expertise. So what have been the major challenges of pandemic era business environment for companies and organizations in your field? Sandy, I want to start with you. So what do you think was the major challenges for small businesses versus in more general corporations or nonprofit organizations? So those are all different bodies, but what's your experience? What's your perspective?
Well, Dr. Golu, thank you so much for having me today. And I'm really happy to represent the Hispanic Chamber of Commerce. And hi to all of your students. It's been a little while since I was a student or been on campus, but I'm really happy that everybody took the time today on Saturday to join us. So one of the interesting things about the San Antonio Hispanic Chamber that you guys might not know is that it is the oldest and largest Hispanic chamber in the U.S. 2 years ago, the gentleman that ran it, Ramiro Cavazos, was tapped to run the U.S. chamber. And so he's up in D.C. sometimes. And so it was really nice that we have done a really good job of promoting our small businesses and nonprofits. As everyone probably knows, small business was the foundation of how we built San Antonio, and it was built on Hispanic-owned businesses. And actually more like 75% of our members right now are small businesses and nonprofits. So when you ask about the pandemic and what that effect has had on them, I'm going to focus a little bit more just on those small businesses. And basically, it was just what everybody thought. There was a lot of insecurity. There was a lot of unsureness about what was going to happen, how long they were going to have to stay closed. A lot of the city and state ordinances about when they could open, what their occupancy was, really stressed them. So one of the things we're working on now, of course, is not only getting them the revenue. A lot of them are really lucky that some of our bars and restaurants were able to actually keep open, but to pivot and to do, of course, our takeout and curbside that a lot of us have taken advantage of to really kind of eat local. So that was a nice positive kind of effect of that. But at the same time, really getting those monies out to those small businesses, those PPP loans, those forgivable loans, and basically all the pandemic and COVID relief funds. One of those things we've been working with a lot of the nonprofits, the city and the county, to push those out to the members so that they know how to apply. One of the challenges has been that if you're a mom and pop and you have a small taqueria, you have a small painting business, you have a tire shop, you don't have access. Just like our students sometimes when they're trying to do school from home or distance learning, they don't have the access or they don't have the knowledge of how to really apply to those. So we've been trying to do those warm handoffs with other banks, with other small business or people that work with small business so that they can actually so that they have the knowledge and can say, hey, there's money out there to help you. You can stay open. Right now, one of the things that I read recently was that 25% or a quarter of small businesses, of course, reported last year that their business reduced anywhere from 25 to 50%. But 70% of those businesses now say that they think they can, if they've made it this far, that they can survive, that they can probably build it back up. But I think the main thing that's going to be a challenge is consumer confidence, letting people go back. I think, didn't we just have a new ordinance where I think we got 75% capacity in restaurants now? And so that's going to be different. Some people still don't feel safe about going back. So building up that consumer confidence is going to be key.
Thank you, Sandy. Now I want to ask the same question to David. David, what do you think was the major challenge for healthcare organizations in general? Of course, when we say healthcare organizations, there are different organizations, like we can talk about hospitals or like physician-run offices. So what do you think was the major challenge for healthcare organizations in general because of this pandemic?
So it's a great question, and it's the one that is most on the nose, I think, for all of us. And it's fortunately or unfortunately very similar to a lot of the aspects that Sandy pointed out. with these small businesses. Much of healthcare is delivered, by either solo practitioners or small clinics. Clinics that are experiencing, a lack of reimbursement, cuts in reimbursement, et cetera. We tend to think of hospital systems, when we think about healthcare sometimes and say, okay, well, how is that being delivered? I like to sort of buy local myself. And when we talk about healthcare, so much of it is delivered not in the acute setting, but really in that physician practice, the clinic setting, the testing, the therapy. I have clients that are in post-acute, in the post-acute world. So, home health, hospice, and therapy organizations. And those folks took a hit. They were taking a hit already on reimbursement. And then they really, really saw in our fee-for-service, we're still so geared towards that fee-for-service model. They took a huge hit. And so a lot of these folks, including your larger systems, had to pivot very quickly, leverage technology, use Zoom, use telemedicine. The silver lining in all this is I think a lot of us really like telemedicine, and that should be here to stay. Just like, we like takeaway margaritas and things like that. We like our telemedicine, and it's so much more convenient to be able to pull out your device and just answer a simple question, go through some mental health screenings for your workforce. And so a lot of these solutions have really emerged to fortify the existing organizations that have strong leaderships and were already agile. I am huge on agility and looking towards technology. I really emphasize that with my clients. I really emphasize that approach for just constant readiness, having a readiness mindset. That's just me. That's with my training in anthropology, I analyze a lot of patient behavior, a lot of consumer behavior. It all goes hand in hand. So when we talk about local restaurants, those are the same customers that are seeking healthcare services. And those patterns of behavior are something that can really give us a lot of insight as to how we should deliver services moving forward. Because guess what? We're never going to go back to the same way of doing business. And a lot of it is going to be for the better. Although this was a really painful time, we saw organizations with really weak balance sheets either go under or have to consolidate, lay people off, which further exacerbated the economic crisis in our city and in our state and our country. But I do like to focus on the positive, and hopefully we'll be able to reopen a bit smarter. A lot of us have already noticed that with flu season in healthcare, there really hasn't been a flu season because guess what? People were isolating, they were washing their hands, they were wearing masks. Again, this new normal is something that is really intriguing to me. I like to focus again on the positive, that silver lining. I think we're going to learn a lot if we already haven't from there.
And you know what, David, I'm just going to piggyback on that. My husband and I had a call at 8 a.m. with his doctor this morning to give us results and to kind of to do a consultation. And it was so easy. We didn't have to drive anywhere. We didn't have to park anywhere. It was fantastic.
It's great. Yeah. It's great. And so many so many folks who are needing the mental health services are actually getting them because they are covered under insurance, and insurance has incentivized folks by saying, you know what, you don't need a copay. We just want you to get the help you need. And hopefully that shifts in our society a greater emphasis on mental health services. We know we need it, and it's just getting that access and lowering those barriers to entry.
Love it.
So Golu, I think that's what I would say as far as, there were challenges, but there's a lot of lessons learned.
Thank you, David. I'm glad that you brought up telemedicine. And I will actually ask a question about the opportunities that this pandemic era brought to us. So we can talk more about this. But I also use telemedicine. I have a good physician friend, and I have been using that for a couple of years. I mean, I don't have the best health insurance, so and have a very good physician friend, so why not, right? So I was very happy using that in the past, my personal experience. So as a follow-up question, I want to ask you about your observation about these companies and organizations in general. So based on your observation, what are the successful strategies to cope with these challenges of pandemic era business environment? So what are the best practices that you have seen so far? Sandy, let's start with you again.
Okay, well, I've got two answers to this. I'm going to give them to you in the form of examples. I was on a call yesterday with SAGE, which is an East Side industry organization, which really helps the East Side businesses where I happen to live to really help them cope. And one of the, we had two people on the call that were owners of childcare centers. And of course, childcare centers have had to completely pivot everything from their cleanliness, the use of gloves. Like one of them was saying she's running out of gloves. But then during the snowstorm, they had a limit on milk at HEB. And she was only allowed to buy 2 gallons, and she goes through 20 gallons a week. And so she had a little bit of a hard time for those people that still need to go to work. And so she still remained open. So we were kind of helping her with some resources there. But I think the short answer to that question is that, like David said, if you started from a strong position, hopefully you were able to pivot and to really change your focus to adapt to these restrictions that we have. I have a great example of, for those of you that might know, Deco Pizzeria. So they opened up, I don't know, I think they've been in business maybe 5-6 years over in the medical center and in the Jefferson area. Yes, not too far from the university. And then what they did is they planned to open up in 2020 an express takeout only over on North New Braunfels on the east side. And I know Jacob Valenzuela, who's one of the owners, really well. And I said, how did it feel to open up a pizza business, during a pandemic? And he says, you know what, Sandy, he goes, everybody needed us to pivot. Everybody wanted curbside and call in. He goes, we were very lucky that we had a very strong online ordering system already. He says, we beefed that up more to make sure that people could pick what they wanted. And then they had a pickup time. So short answer really is it's those companies that started with a strong position and that were able to pivot to reflect not only what the pandemic was restricting, but also what people were comfortable doing.
Yeah, and you're exactly right, and it's funny how there's so many parallels with the restaurant and healthcare. It just, and I never really thought of it that way. I have a lot of friends in the restaurant business as well, and what was interesting to me is that from a healthcare organizational perspective, we have been preaching till we're blue in the face about having a stronger digital presence, having a stronger digital front door for your patients. And guess what? This forced it. It really did. There were some executives that didn't want to spend whatever it was to either, it's not like you had to create an app, although that would be pretty cool, but just strengthen that digital front door, establish that so that when we talk about patient engagement, it's easy, it's accessible, and it's something that allowed the patient to access these healthcare services when needed. So again, it goes towards the corporate culture, I think, of the organization. You have restaurateurs like your friend who had that mindset of saying, you know what, we're going to look a little further, take it on the nose as far as whatever expenses it is to create that digital avenue, a curbside express, and you'll see that between healthcare services and in the restaurant industry and in local business. E-commerce has really become something that was really invaluable. Those folks who already had a great, digital presence, they were able to really kind of operate a little more seamlessly. Yes, they had to make some adjustments with spacing, sanitization between, seeing patients, and things like that. But I mean,
I think about Uber a lot when you talk about pivoting too, because even though we're not taking Uber to go to places anymore, we still need Uber drivers to deliver stuff and favor and things like that. So that is to me one of the greatest examples of saying, okay, we're doing something well. Now, how do we do it to adapt to this environment now?
right, absolutely, and I think you see that in all across healthcare organizations, food, local business. Everybody had to really engage that those platforms and rely on them. So if they weren't on Uber Eats before, then they had to be. And so and we saw some disruption there. I mean, there was an article about Sichuan House, one of my very favorite, very authentic. Sichuan places, and what they did was they used a postal delivery service, and they rewired that, they retweaked it to their delivery service because the fees were so much lower. And that's another thing, is the economics of the digital transformation. Recently, I've been starting to pivot and start to use the digital transformation verbiage, because that's what it really entails, is the soup to nuts, from corporate culture to policies to processes to the outputs, that encompasses that. And I think digital transformation is here to stay.
David, are you seeing that some of the healthcare industries are having to scale down some of their services? Because that's what we saw, that, of course, in the restaurants and the bars, where maybe they're not going to have access to their whole menu now. And just to kind of keep going with this, how strangely, aligned these two industries are, is that happening in healthcare?
To some degree, yes. What we saw was ancillary services. We saw folks with, clinic setups that either through supply chain constraints couldn't offer the types of more elective procedures.
Right.
They had to focus on what they did best.
Yeah.
And they really had to entrench and just start treating folks. If you're talking about a hospital system, a lot of these ambulatory surgery centers were the first to kind of hunker down for a bit. They didn't let staff go immediately. A lot of times they just sort of furloughed for a while until they could get those operations up and running. But in the acute setting, in your hospital settings, it was just a complete transformation of taking floors and converting them to COVID floors. And so where you would do rad onc or radiation oncology, where you would do some different services, hey, that's a COVID floor now. And really the adverse effect is that now patients who needed those services couldn't get them because there was a misalignment in the supply chain and just basically the supply and demand. And so unfortunately, what we've also seen is that because of some services being shuttered or delayed, some patients would exacerbate, so they get worse, and then they would have to seek emergency services, which would further strain the system.
I think we're going to see just a lot of babies this year.
Yeah, you'll see a lot of quarantine babies, I can tell you that. And as of last week, I mean,
I can't wait till those numbers come out and we see what kind of baby boom in a pandemic.
Yeah, absolutely. Yeah.
Well, thank you both. I just want to switch to the next question. So to some extent, you have answered this question, but if you want to emphasize a specific opportunity more, that would be great, or if you want to add something else. So what are some of the opportunities for businesses or organizations that the pandemic has created in your perspective, Sandy?
I would probably just go back to the original thing we had talked about, is that it's really nice that now we have this beautiful push to support our local businesses, to eat local, to drink local, to buy local. And I think that to me is an unintended positive consequence.
Yeah, and I agree with you. I think from a healthcare perspective, healthcare organizations are now, they've done the spend on the digital side. They've put in their processes to make things accessible. They've adopted remote working for their administrative type workers. They're more open to telemedicine now that they've been incentivized to do so. I hope we can keep our telemedicine and expand that further. But it also allowed folks to really kind of take a second look at how we were delivering healthcare. In the traditional model, it was very cumbersome. Visiting the doctor's office or getting a lab, there's just a lot of steps, and it was hard for folks, especially folks who didn't understand how to navigate the system to get that level of care. Luckily, the Biden administration has expanded the Affordable Care Act and that enrollment. And I think what we're going to see there is now we're capturing more folks who are going to enroll and get some coverage. We really need more folks to get coverage, and then of course that's going to help us to deliver really great preventative care and also just acute care.
Thank you both. So also you mentioned in a couple places about this, but do you see that this pandemic will change the way we do business, like moving forward for both small businesses, for corporations, or for healthcare organizations? Do you see that there will be certain permanent changes, both in the demand side and in the supply side? So for healthcare industry, from the demand from the patients, and also the way how we deliver healthcare, or when we think of the small businesses, do you see that a permanent change will take place in the demand side and also in the corporation side? We can maybe talk about land and office space, the valuation of those, or like winners and losers of this pandemic in general. So I'll let you speak.
So there's a lot of puzzle pieces there, but let's talk about to what David had said about the way that people are changing businesses in positive ways, streamlining their services, having a digital presence that's a little bit better. I bought a car last year right in the middle of the pandemic, and it was the best car buying experience I ever had because it was completely online. They dropped off my car, picked up my other one. It was fantastic, and I never had to spend a lot of time waiting like we normally would have done in dealerships. So I was thrilled with that. That's the only way I'm going to buy a car moving forward. And so I think that there are some streamlined processes that have been really helped by the pandemic. I'm going to let David, I'm going to let you take over, like talking about the health issues and how that's kind of, I think it's positive, like you said, that we've had a lower flu season. But to talk about office space, one of the things, if you remember, that was an essential service was construction. So those buildings that were in the middle of being built, I actually came from a construction firm. I worked for them for 2 years, a national construction firm. They built a lot of the Amazons and a lot of these big warehouses, and their business just took off because people were doing the distribution centers. And of course, you guys saw that how many Amazons are now coming to San Antonio, that there's the fulfillment centers and the last mile centers, because people are ordering more things online. Everybody kind of naturally assumes that, oh, we're all going to be working from home and everybody needs a home office in their house now. You know what? This is my home office and this is my living room. So I don't have a home office in my house, and I don't plan on looking for a place or putting one in because this works for me. At the same time, I want to go to work. I'm fortunate, or just different in the fact that I have grown children, so I'm not having to teach them at home. But I do want to leave the house. I do want to go somewhere else. Now, while office space might not be necessary for a lot of people anymore, I think that we'll definitely see a dip in the in people offering office spaces. But I'm not seeing price changes, honestly, in office spaces yet, because people haven't definitively said everybody's working from home now. I think people still want to be together. I mean, if you just take a look at our educational systems, one of the things that people kept saying, and as a former educator and a former teacher, and you guys know this, I want to teach in person. I want to see people. I want to engage with them. I want to have better discussion one-on-one, be able to read people. And I think that there is some brainstorming that happens in the office, those kind of stand-up hallway meetings, that we're not seeing that level of engagement that we're going to see at home, which to me makes me think that although people may be in their office less, we're still going to need that space.
Yeah, I think you're exactly right, Sandy. There is something about sort of impromptu collaboration. There's some innovation that just happens sometimes that you can't plan for. You can't say, on this next Zoom meeting, I'm going to have an aha moment. Those aren't timed. And so, what I think you're going to see in the healthcare sector is that there's going to be a hybridization of, maybe 3 days on, 3 days off site. There's going to be an emphasis on maybe some smarter spaces, maybe some collaborative spaces that can occur. I think the benefit to this remote experience is that now it makes it okay. The old sort of mentality was, oh, sure, you're working from home and you're doing a whole lot of like not working,
Yeah.
and which is not the case. I mean, I know so many folks who are working professionals and they actually work longer hours at
Right.
home. So they can't
Right.
wait to get to the office because they're like, I'm at 9:30 at night, hopping on a Zoom or answering emails. And so I think that you'll see the hybridization of on-site, off-site usage. I think we're going to be smarter about the spaces we design for the future. And I think that the open workspace, which I was partially a fan of because I like the collaborative approach, but I also didn't like that because people in sort of by our very nature, we need some semblance of privacy. So there was this whole open workspace initiative where it was, people hardly had
Now
privacy.
you can't do it. Now you can't do it as comfortably.
Kind of,
Yeah.
fortunately, you can't because of transmission and things like that. But you could still design hybrid workspaces, and I think that the meaning of, hey, I've got to take a day off because I've got to take care of my sick kid. I'm working from home. People will have a newfound respect for that. Also, the same thing for virtual learning. If you have kids, I've got 3 kids, and they're all in school, and they've been in person for a couple of weeks now, which has been pretty amazing. So I had lost my home office to them.
Yeah.
So I was working in the kitchen, in the dining room, and so I got my office back, and so. But one thing that'll be interesting is on these snow days, will we have virtual school? Will we have some virtual lessons that'll supplement so you're not losing a whole entire day of productivity? And I know that's not healthcare-ish, but it's a byproduct. And so I think you can see some less sick days, some more digitalization of what we have on paper, maybe in the cloud, in those cloud services.
Yeah, and I think you're right about when you talk about how it's hard to leave your home office. Your laptop is always there staring at you. And so you have to kind of, I was putting myself on pretty strict 7 a.m. to 7 p.m. Rules when I was at home. One of the things, and Dr. Ghaly, this might be interesting for the class. I was able to take a tour of Credit Human the first week of the year before they all moved in. And of course, this is the big building that's off of 281 and Broadway there. I know the CEO really well. We went to college together at St. Mary's, and they designed that space with this openness in mind before, of course, the pandemic, knowing that they would hopefully be in it in 2020, and they're not getting in it until this year. But they did a lot of things where they wanted to make sure that they had those small collaborative spaces. Every single one of their people and their executives is in a cubicle, including the CEO. And they're switching cubicles every 18 months so that they all get to know each other. Because if you think about the financial services just have always been restricted based on federal regulations. Like, these people confidentially can't talk to these people. They're behind a locked door with a combination on it. He says, and we just took that all away and said, no, we need to get to know each other. So they do have these really interested, large, more formal kind of like conference rooms, smaller little spaces with lower chairs, little booths, little corner nooks. So it's really interesting to see, but that would be a really fun just study psychologically. And that's what they had to do. They had to bring in a business psychologist to kind of help them navigate on how to develop that kind of space. So yeah, that would definitely be worth your while to take a tour of that building. It was incredible. And of course, it's also like, platinum LEED certified and amazing.
That's a beautiful building. Yeah, but I agree. There's some value to the collaborative aspect, and basically to stave away silos in an organization. I think that the rotating concept is actually pretty cool. That's
so they get to
something
know each other because they normally wouldn't. And you can't
Right.
eat at your desk. That was the other thing. They have a whole floor
Really.
where they have different spaces. They do not want you eating at your desk. They don't have those refrigerators in the corners or anything. You got to get up and go see some other part of the building.
That's great. That is
Very
great.
interesting. It's very insightful and fun to listen to you, so I don't want to interrupt, but I also want to open the floor for the screen for space for questions. So if you have any questions, you can put it in the chat or you can unmute yourself and ask. I see one question, so I will start with that, but I want to mention also regarding land prices, I guess, or office prices, I guess the extra lower interest rates played an important role. So in the past year, all the infrastructure prices also hiked. So I want to start with Dr. Turpin's question. She says, any thoughts on the effects on worker health of working remotely at home versus going into work every day?
I'll let you take that one, David.
Okay, happy to do it. As Dr. Turpin is kind of alluding to, is there is a toll, a mental health toll and a physical health toll of remote working and being locked inside, your home and distancing for so long. As many of you are probably aware, there was a shortage of mental health professionals. Medications for depression and all of these other mental health side effects, mental health conditions are through the roof. And so there's just a lot of folks need help, and a lot of the isolation that comes with working remotely can really have a negative effect. So I think it's about balance. I think that what we have to see is a balance of folks being able to have some contact. We're social beings by our very nature, and we need to have some sort of a regular contact. Many of us were starved at some point for some socialization, and it's a real condition, to be depressed from that. And so we've seen a lot of those adverse side effects of such isolation, but also the physical side effects, which sort of compound on each other, is obviously being so sedentary, folks are not working out, which can also exacerbate and further that cycle of depression, and then poor eating habits and things like that. So it is a cycle that has to break. I think that now more than ever, we really, really have to think about legislatively funding more mental health services and behavioral health services for folks, for workers, and have that as part of the benefits package of most organizations. Have it stigma free. That is one thing that we need to remove, is the stigma about mental health conditions.
And what was the joke that everybody was saying is, on the other side of the pandemic, you're either going to come out a hunk, a chunk, or a drunk?
It could be a combination. There could probably be some combination of all three. So
yeah, and it is. And to your point, I heard also people say that this is an introvert's dream and an extrovert's nightmare, and I disagree with that. I mean, those of us that are extroverts, actually, I appreciated the time to just dial it down a little bit. But yeah, I was missing going out, seeing people, and hugging people. So
same here. As an extrovert, it was funny because it felt like a reprieve for me, like a little vacation. And then after a while, of course, it was not a vacation, and I was like,
got old quick.
Somebody, but it's nice to now not have to have so many obligations, so many social obligations. So, yeah.
Thank you, David. Any other questions from the audience?
I saw that one that Emilio had asked about the boom of home purchases. I'm sure a lot of people were just, because they weren't spending money going out, that they were spending money staying in. So I would love to see that as well. What were these purchases? I'm sure Amazon has an incredible increase, and that what may have led to the real estate increase. Okay, I have an answer for that one. For residential homes, this is a very interesting one. that is just, now we all think it's a seller's market. I'm just going to be on the residential home side because people said, I'm going to stay put. I'm not going to look for a home. I'm not going to put my home on the market. I don't feel comfortable moving right now with people touching my stuff or anything like that. So I think that has really made real estate prices go up in somewhat of a positive way. But at the same time, we don't have the inventory now to choose from. I mean, I've had a couple of people that have bought houses in the past year and they're like, I lost the first two that I bid on. So I can totally understand that. So I don't think we've seen too much of a price differential in commercial markets yet, because people, like I said, people are still building. People haven't completely abandoned the idea of an office that's not in your home. But I think that's going to probably shake out in the next couple of years. But I mean, we still see cranes all over town.
Right, and I think it's, with the news of the vaccine, that reignited hope for folks that there could be a day that they can go back to the office, even if it's 2 or 3 days of the week. And I think that you also see the boom in home sales attributed to working professionals who had the jobs, who could afford them the luxury to work from home. I think one thing that we need to touch on, it would be remiss of us, especially being OLOU and who we are, to not touch on the digital divide. And I think that the digital divide is a byproduct of the economic divide, a much larger issue. And I think that we saw this pandemic also kind of further that chasm a bit. Those of us who could work from home, it was easy transition. Folks who had to go to work, that's a much more
hospitality. Yes,
a much more difficult conversation, and it's a much more painful one. So, yeah.
Yeah, the schools were doing a good job with that. I live in the second highest poverty zip code in the city, and the digital divide is different, like you said, is the people that have to go to work versus I have a lot more blue collar than I have white collar here. But at the same time, we saw the digital divide really in the virtual learning.
Right.
I live in SAISD now, and they did a pretty good job of the outreach and making sure people had hotspots and making sure students had laptops and that they were accessible. But that's a real big difference when you throw on top of their energy fees. And regardless of the snowstorm, I think we forgot a little bit about the power that it takes to kind of generate this, and people sometimes are not that used to powering up 3 laptops for their kids.
Right. I think that's a great point. And what I thought, it just made me love my city more. What I found useful was when Viatran, not Viatrans, but when Via parked buses for hotspots in areas with low to no broadband accessibility. And I was like, this is great. And hopefully what this will do is put internet and broadband as a utility, because on a global scale, when you see kids in South Korea, kids in Sweden, for example, who have ultra fast, prolific access to high speed internet, the advancements as a nation that these folks will make could outpace us, in the long run. So I think that putting broadband access as a utility designation, it sounded far-fetched even a couple of years ago, but this pandemic has brought it to light and said, no, it's got to be a utility. We need
the other side of that coin, though.
Access. I'm sorry.
I was going to say, not to be combative, but the other side of that coin is, and I'm thinking about my members, is the Spectrums, the AT&Ts, the Time Warners. If we go to a full smart city, then you're going to have the CPS and the SAWS issue where we're not going to have that competitive choice anymore.
Right.
So that's all I'm going to say about that. I used to work for SAWS.
And there's nothing wrong with, I think, some smart public-private partnerships in that realm, so that you can have an infrastructure that's federally built, but then you also have some marketplace competition. And I think there's some models for that we could explore as a country. So that would be pretty interesting.
Totally agree.
Mm-hmm.
Any more questions in that chat?
I don't see any more questions.
I have something real quick. This is Christina. I just want to thank you first and foremost for the enlightening conversation. And I'm a fan of architecture and design. And so some of the things that you were saying as far as the setup of office spaces and what that might look like in future, I found to be really intriguing. Because I'm thinking, for instance, what is the point of going to work physically somewhere? Because in our case, for instance, we have a suite for our department faculty, and we go to our individual offices. So I wonder if that is going to change in future, that we're going to have more communal spaces, because when we go to work, we want to be with people, right? We're going to want to be around them maybe a little bit more instead of just hiding out in our offices, as the case may be sometimes.
You definitely need to tour Credit Human. It's amazing.
So
I think that
just wanted to add that. Thank you.
I think what we'll see is and that's a great question, is probably some more multi-use, multifunctional design. And I think that we'll find that office spaces are going to kind of transform to some collaborative, some maybe even some recuperation, rooms, just places to take a nap. And so just some new and out of the box features that allow for folks to be a little more human at the workspace.
Okay, we have Thomas who has a question. Thomas, do you want to unmute yourself and ask, or?
Yeah, I can unmute myself. I'm trying to figure out how to word this question properly. But anyways, to give a little backstory, I work in radiation oncology. I'm a student there. But because we've seen a decline in elective healthcare, like non-pertinent healthcare, and I feel like that's the case in cancer treatment. Will our cancer treatment in San Antonio be able to see the influx of care when people are comfortable to come out and actually get treatment? And I think that's more for you, Mr. Tapia, but
no, I appreciate that. And it's funny how I think it's serendipitous that you happen to work in RadOnc. I think a couple things will happen. We will find ourselves with an initial influx of patients that need RadOnc and those services. But there could be some folks that, because of the delay of seeking healthcare services, they've declined so significantly that they might need interventions in the acute setting sooner. And so I have a lot of physician friends that worry about those sick patients that need healthcare, and they were scared to access healthcare. It was because they didn't want to get COVID. And so again, the vaccination is going to be the key to really unlocking folks as far as accessing services, but also engaging in the overall economy and patronizing those bars and restaurants and patronizing healthcare providers. So I think you'll see an influx initially, hopefully some stabilization, but again, the vaccine having been disseminated, if it gets disseminated effectively, maybe we can brace ourselves before that influx.
Yeah, that makes sense. I know. So I'm a student at the Mays Cancer Center, and I know they were giving vaccines to patients who were getting treated. But I just wondered because I know there are already healthcare. Most people don't get cancer treatment as is until it's like almost too late. So I didn't know if there's going to be an even bigger spike in the fact of like because we're all trying to get to preventative care with healthcare. And
I think you're going to see and that's also because of the cases that it's going to be a sobering spike for our healthcare system. Again, there are going to be undetected cases that will come through.
Thomas, this is a great
Awesome. Thank you.
actually. Thank you for bringing this up. Whether the COVID situation will have an impact on the general healthcare of the population, including mortality in cancer cases, is a very big actual research question. It's a big interruption. I wish we had a good comparison group also to make that analysis. But I want to just mention from the real estate business, like the prices are going up. So Emilio's question is also about that. One reason of like prices going up was the interest rate going down very dramatically, and also people delayed purchasing their houses. So that created a backloaded demand in for real estate. So that also,
And we have low interest rates too. So
exactly, very low interest rates, backloaded demand, and that put a lot of impact on the demand. And also some construction companies have delayed their new construction business. So that also put a limit to the supply, which all had an impact on the prices. Now, applying that to healthcare, not like possible one-to-one, because you can buy a house anytime, but you cannot get healthcare anytime, especially in the case of cancer, when it is in the later stages. It is now almost impossible to cure. Well, you know better than me about that, but it is very hard to cure later stages of cancer. So I think it's a very, very interesting research question to dig into, whether this delay in getting preventative care had an impact on mortality rates. I think this is a very good research question that we should.
Yeah, who needs a thesis or dissertation topic? There it is.
Well, I want to thank you all for this very, very nice, insightful conversation. It was very fun to listen to you, and I'm sure that our guests also enjoyed this. We came to the end of our conversation. If you want to stay and ask questions to our guests, you are more than welcome, of course, if you have time and would like to receive more questions. But otherwise, we ended our session. Thank you for attending, and thank you for your times, very valuable times. So hopefully we want to see you in future in different events. So thank you.
Yeah, absolutely. And David, I will be on a panel with you anytime, man. Thank you so much.
Oh, that's awesome. Yeah, same here. I mean, I think we had a great dialogue. Yeah, thanks for the invite, Dr. Golu. So
it's always fun to chat with David. So
this is and he knows that I like to patronize local coffee spots and things like that. So yeah, support local when you can. It's so important. Yes.
Please do. You guys have a good Saturday. I need to jump off, but thank you so much. I appreciate it. Hope this was helpful to everybody.
Thank you, Dr.
Thank you. Have a good one. I'm also going to have to exit as well. So if anybody has questions, just send them to Dr. Golu, and he has my contact info as well. Thank you.
Sounds good, David. Thank you. Thank you for your time.
Of course. Thank you. Mm-hmm.
Have a good weekend.
You too.